guys. This is Dr. Bidmos with Public Health Talks. And today I will be talking about girls' health, the importance of educating and empowering young girls about their health in underserved populations. And today I have with me Dr. Weyoms to help me facilitate that discussion. So welcome to the show, Dr. Weyoms. I'm so glad to have you here on the show with me today.
Thank you so much. It's a pleasure.
Thank you. And a brief bio about Dr. Weyoms. She's a pediatrician. I want to be like her when I grow up. She has several interests, one of them being public and environmental health. She's the Education and Health Programs Director of Coastal and Marine Areas Development Initiative, managing the Community Girl Project. She's also the co-founder of Action GS, a social enterprise that focuses on environmental education in schools and communities. She works to provide young people, especially girls, with positive tools in the areas of education, health, and environment, and advocates of quality education, safe water access, sanitation and hygiene, and positive environmental change. She's currently a PhD candidate at the Leeds University, UK. Welcome again to the show.
Thank you so much, Dr. Khalifa. Thank you. Don't forget that bio.
Well, we have to say it, So, according to the WHO, there are 1.8 billion young people in the world, and the majority live in the developing countries. They are the largest generation of youths in history. Approximately half of them, 900 million to be exact, are adolescent girls and young women. Educating girls and women improves health outcomes, which this has been proven. And despite progress made over the last 20 years, girls are still less likely than boys to attend schools. So as a pediatrician and advocate of young girls' health, from your own experience, what are some basic needs you feel girls lack in terms of their health in underserved communities?
Thank you, Dr. Khalifa. Quite an interesting statistics, which I must say is still a work in progress. From my experience, what girls are lacking is access to quality healthcare, whatever kind of healthcare, whether at primary level, secondary, or at tertiary. They don't have access to quality healthcare. So working with lots of young girls, many are, they don't even understand their bodies. So they don't even have health education to begin with, to understand, okay, this is why I am changing, or this is why this is happening to my body. So there's, first of all, that no basic healthcare access. And if we break it down, they don't have proper sexual and reproductive health care access as well. You're talking about what a teenager is supposed to know at puberty. We're talking about knowledge about menstruation, what to do when maybe you're having menstrual cramps or pains or syndromes. You don't know what to do. So it's whatever you hear you think is right that you do. We talk about the reproductive part where they are making wrong choices in terms of what they're supposed to do. So girl likes boy, girl doesn't understand that it's supposed to be a safe kind of relationship. So she just goes on, does what she likes, and then at the end, sometimes she doesn't know she's pregnant. It's her mother or someone that points out that she's pregnant. So that is one angle. So girl is growing up, she doesn't also know that food has an impact on what she's supposed to do or how she's supposed to live. So there's this nutritional aspect of it. She also doesn't know that, because nutrition goes with physical activity, because that leads on to adulthood of hypertension and all the non-communicable diseases that we have. So we now have nutrition and physical activity. She doesn't know that it's normal to exercise, it's normal to have a balanced diet. So she sees physical activity like what the big ladies do just to keep fit. Like, I want to be like our girls or our senior aunties. So she doesn't know it's supposed to be a part of her because it's not introduced to her. Also, in terms of environment, she's not aware that our environment, like for my experience, we come from the Niger Delta where there is a lot of pollution. So we don't know, many people, especially for the women, they don't know that the water they are fetching or the water that they are using is affecting them, or because most of us stay by the refinery, we don't know that the air we are taking in is also affecting our bodies. So they just, in terms again, education sums up that aspect of the environment. So those are the basic things that get to affect girls in our areas.
So why are you, because I hear you talk, and
Yeah.
I just see so why are you so passionate about this public health topic?
Um, when we say public health, most times everybody feels like, oh, it's gbogbo everybody's doing public health, but
Yeah.
nobody, like, people don't really see the public health. People really hear it on paper. So I'm so passionate. Let us do things that, yes, we'll physically see it in the communities. This is what we are doing. So I'm so passionate about it because of where I come from. So I come from a place where there's a lot of barriers. So barriers starting from your family, first of all. So your family may have that mentality that a girl is not supposed to go to school, or a girl is supposed to end up in the kitchen, which they are trying to come out from, but there's still other barriers so we have this ideology because we are from the place where they produce the oil. Oh, I don't need to go to school. I just maybe need to go to school to maybe
And also, right? Mm-hmm.
yes, mine is secondary school, and then maybe look for a job or start selling, or then start aiming for the guys who are working in the oil company, marry them, tell him to buy you a Jeep, and then you get to have a shop. That's life. So, and public health is so encompassing. It's not just one part, it has a lot of it. It has health, education, it has environment. So seeing where I come from, I'm so passionate about it. And when we returned from the UK the first time in 2016, we realized for every 10 girls we were seeing, we would see nothing less than 7 between the age of 12 and 15 being pregnant. And they carry the pregnancy with pride. So let's say we are driving a 30 minutes kind of movement around town, you would see teenage girls. So you're counting, you've seen 10 girls, you see that 7 of them are pregnant, and you're like, what's going on? So that's where the whole passion came from.
Oh, that's interesting. Now I know you touched a little bit earlier about the physical activity and nutrition aspect of it, but I want to go a little bit more into that.
Okay.
So specifically, like for girls in Nigeria, like the physical activity and nutrition. So why do you think this matter when we talk about the physical and the nutrition aspect for young girls in Nigeria specifically?
Yeah, because of another thing is we're not really having a lot of concrete statistics. So we always have sub-Saharan statistics, sub-Saharan Africa. I don't know why we don't focus so much on our adolescents, or because of that's my area of work, we don't have so much data. But finding out and working with girls and doing my PhD, I realized that nutrition is actually really essential for the Nigerian girl. Why is it essential? She first of all, she's in a very resourceful kind of country that has lots of food, but at the same time, she does not explore those food. So she's restricted to certain types of diet, and she sometimes feels that, oh, this is not good, I need to incorporate a Western diet. Nutrition is very important. First of all, if a girl does not eat a balanced diet, our well-being is going to be deteriorating. First of all, she's hungry. And a young girl who is hungry and going to school, she's not going to be able to concentrate. That's educational part of it. Her cognitive level is going to be low. She's not eating, and she's now approaching puberty. She's now approaching where a stage where she's now starting her menstrual period. She's not eating balanced diet. Nutrition plays a key role in menstrual health. So she's not eating. She's eating just whatever she can find, or she doesn't care whether it's more carbohydrate, more fats, or more sugars. She's going to have anemia. And from what I see, based on it's just an approximate of what I look at when I talk to lots of them. Do you know about iron? iron deficiency? Do you know that you can have anemia? But they're like, no, I eat healthy, this. But when you check them, you realize that anemia is very common. So nutrition has to play with anemia. And then you're losing blood during your menstrual period, you're going to be anemic. And coupled with the fact you're also not getting vitamins or other micronutrients from the food you're eating, you're adding more complexity to whatever is going to happen. And because of the food insecurity that is rising these days, and from my research, some girls go one meal a day, or they go um, 001 or 011, and they don't know the effect it has on them. They're growing, but it's stunning their growth gradually. Another thing is an adolescent girl who's not eating properly or who has deficiency in balanced diet may get pregnant. Her growth is going to be stunted when she gets pregnant because she also does not have the capacity to be able to take care of the newborn. So you're going to be having a malnourished baby by the time we are giving birth to the baby, and a malnourished mother who has slowed her growth because of nutrition. So
But I
those
mean,
are the
isn't that part of it being having access to basic food?
Yes, so that comes again to food, basic food. Yes, so and then because we Nigerians don't look at what we do from a young age, we're not so considerate about what we do. They feel children are children, but what you during the childhood affects the adulthood. So he's a child. She can eat anything. She can do whatever she wants. She doesn't need to play around. She needs to sit down. So not
We are
exercise.
risking childhood obesity also, with that.
Yes.
Yeah.
So, and then we are slowly progressing into adulthood hypertension,
Yeah.
adulthood diabetes, and all that. So, but they think it's starting maybe when you're 30 or you're 40, but it started like from very young age.
Yeah.
Yeah, yeah. So that's another issue.
That's a lot of load of information. Because, like I said, we can take childhood obesity from there, malnutrition, a lot of stuff, like going on there.
Yes.
It comes down to having access to the right thing, and also providing the education to parents, in this case, to know that, okay, this thing starts from early age in terms of, feeding your kids the right nutrients to help them develop into the adults that we want them in terms of their health and the other stuff, growth and other stuff as well.
Yeah.
Yeah. So now, what are some of the implications of this? In terms of what you just described. What do you think some of the implications are?
Oh my days. I think we dread talking about the implications.
Yeah.
Implications are so much. Like you said, malnutrition, childhood obesity, we're going on sedentary lifestyle. We keep going on to that. We have, if the girls end up getting pregnant when there's no education about safe access to contraceptives or whatever day choices they make, we now start having pregnant mothers who are teenagers, and then stunted growth, malnourished children. We go into the circle of mental health, teenage pregnancy, depression. So it keeps going on. We keep coming out with a lot of school dropouts. So the more you say, it's like you're unpacking a very big a very big
Yeah.
present. So you just only this present is a bad one. So you just keep going unboxing. So we have a whole lot: childhood obesity, teenage pregnancy, stunted growth, anemia. You can also end up having some maternal complications
Yeah.
during birth. So it keeps going on and on. Education is part of that. She drops out of school. She's now fending for herself. She has now been cut off and put into the statistics of, okay, school dropout, teenager, no access to good health care. She's also now becoming not knowledgeable about what to do for herself.
So she's doing the same thing with her child. Hopefully not, like raising that child, it continues on like that.
Our parents have unrepaired or broken relationships that they've not mended. So they've gone through a lot of things. Some have seen wars, some have seen crisis, some have gone through crazy situations. They've made some wrong choices. They also did not get enough education that they needed. So they are broken, and because it's not repaired, they don't know how to take care of some of the girls. So, like for example, women who didn't go to school, they are striving for their daughters to also go to school, but sometimes they go the extra mile or the extreme mile to see that that girl goes to school, and it breaks the child. It's like, there are sort of words we say as parents, and then it's affecting the child. So first of all, the Nigerian girl child is as if she's silent. She doesn't have a voice of her own. So we are made that children don't talk. Yes, out of respect, children do talk, but sometimes we lose what they need because we don't want them to tell us, Mommy, this is good for me, or Mommy, I think I want to try this, or I want to try that. They only try it when they are adults, and it's already sometimes too late. So first of all, we need to make sure that the voice of a Nigerian child is heard. Girls, they are heard. Ask them their opinions. So I'll take an instance for an example is for the project I run, we get to ask girls, what do you want to learn? What is it you want to learn? It's like
they are part of the whole process. So
yes,
get them involved. Yeah.
yes. So I think everybody should involve a girl child. So ask her, what would you like? Conversations you have may actually tell you what a girl child may want. You know where she's thinking towards, and you would know that, okay, you're good at it. This is it. Start building that self-esteem. You're more than just being in the kitchen. You are more than just the girl that the boys will say, Ace, come here. You carry yourself. Like, I'll give an example. My father will always say, don't allow any boy intimidate you. So he was always saying that don't allow any boy intimidate you. If it's engineering, go for engineering. If it's medicine, go for medicine. If a boy says, oh, I will write and I will do well in the essay, you too write and do well in the essay. You fit that position as well. So when we start talking to girls like that, not shunning them down, not saying you're second-class citizens, but giving them that voice. Okay, you say you want to be a doctor and you're a girl. Don't say, who go marry you? Or when you go to finish school, those kind of statements. Or your age, you're doing 4-year course, you want to do 6-year course. So tell them, you can do it. How far do you want to go in this kind of thing? So let us build their self-esteem with the words we say and how we act towards them. So basically.
So how do we, from raising their
self-worth,
raising our girls with self-worth, now how do we go from there to helping them, with their mental health? Because with all of this that we've been talking about, I mean, this is enough to trigger any kind of stress for a girl child being second class, or like you said, not being allowed to talk in a family because you're like, oh yeah, you're a girl, that kind of thing, right? So how do we help them protect their mental health?
I'm not a believer of a one-off thing. That's why the project I run is a long-term. It's going on for 4 years. The girls come. Some have gone to university. Some have gone to police. Some have stopped coming. So it's not a one-day thing. This thing we're talking about because we've had it for a long time. That is how our society has been built. That girls are kind of quiet, and even generally the Nigerian child, but. We need to start setting up things, or in schools we need to have long-term approaches or interventions that would help their mental health. It's one thing, like we always say, it's one thing for me to tell a girl I'm seeing the first time, I say, you should do this, you should do that, you should do this. It ends there. It doesn't have follow-up. What if something happens again? What if she meets a death situation and she needs help, but there's nobody to help her? Where's that lady that was talking to me that day?
So like checking on her every now and then.
Yeah, so there needs to be a system where there's like a safe space a young girl can go to. Please, I need help. Please, I need this. Questions to ask. I need those kind of questions. If you watch the MTV Sugar, when the girls go to the clinic, like going to ask questions about contraceptive, the way the woman in one of the scenes, the episode, she almost looked at her like, "What's wrong with you? What are you doing here asking those questions?" But yes, if they have safe spaces, if we create safe spaces, safe places, it could be in school, in churches, in mosques, anywhere, somebody is there to answer their questions. Somebody is there to guide them. I think we will do better.
Yeah, I agree because sometimes, the fear of being judged prevents some of these girls in terms of asking for help and sort of internalizing all the problems that they're going through, sort of like,
Yeah.
trigger or affect their mental health in the long run.
Yes.
Yeah.
So
So, why do you think when we talk about a girl child, why do you think their health matter?
with these days we're talking, there's a lot going on the social media space,
Yeah.
and majority
In
we're
the
talking
world
about
generally, there's a lot going in the world,
in the world,
in
in
the
the
world.
world, in the world right now. In fact, it's
Yeah,
just because we are on lockdown and some people are not feeling the tension. They feel it's just on social media. The world right now is going through a lot of things. The world has also been going through a lot of things that we don't talk about. For example, in Nigeria, if we were talking about rape 10 years ago, it would be different from the way we're talking about rape now.
absolutely.
So
Yeah,
I, I feel the way we're talking about these things right now, the way we are making it now for the girl child, it is important. This
yeah.
is what we're supposed to talk about. These are those things we shy away from. Like in my one of the communities where we are, they shame the girls
Hmm.
when they are raped.
Yeah.
So they walk you around the community
Oh,
and tell everybody that you were raped. So when we start having those kind of conversations with everybody, like you're not supposed to do these things. So by the time we start having this standing up and saying that this is important for the girl child, you don't just wake up and treat a woman like she's a second class citizen. Don't treat the girls like that as a second class citizen. They have voices. Ask them, how are you? How is school? What would you like to do? What are you passing through? Don't shut them down. So we need to start standing up for them, because if a girl, for instance, is growing up, she does not have the guidance. There's nobody to talk to her. There's nobody to that. Her mental health, physical health, and everything is going to be affected
perfect. Yeah.
all the way. Education is going to be affected. Because if my mental health, for instance, which is like the priority of everything, if it's not balanced, I won't concentrate in school. I
Yeah.
would take very wrong decisions. Wrong decisions, I may try drugs. Wrong decisions, I may start to take alcohol. Then we are now under substance abuse. I may also, because under my substance abuse, I am now going to start having wrong decisions in the kind of relationship I'm having. Those relationships, I may not have good choices for contraceptive choices. I may decide to do whatever I like. I get pregnant. Getting pregnant, you either do two things: you keep the baby in shame, or you abort the baby in secret. Nigeria has not legalized abortion. So the list is going on. So her mental health, her whole life. So she grows up to be a broken woman who
Yeah.
has internalized a lot of things. And when you talk to her, you think, oh, this woman,
Everything's fine.
she's
Yeah.
yes. You think and when she rages out, you say she's an angry black woman.
Exactly.
No, she's internalized her problem. She's fixed it in the best way she could. She
Yeah.
has kept some things because of shame. So I think we should shift from that place and know that everything connects. Health environment. What kind of environment is this girl coming from? Rugged environment. I've seen girls who have grown up in environments where it is okay for your stepfather to sleep with you. Okay, where your brother-in-law sleeps with you and your father says it's don't say anything.
Where is this
It's
happening again?
when because we're based in Warri, we get to hear a lot of things. So what we do is we have this anonymous box. When we started, we have what we call anonymous box. So anonymous box is write a question or write a question out. Don't put your name, don't put your age, don't put anything. Put it in the box or give it to any of the volunteers that are or the facilitators. So the girls took advantage of that. So they would, for any topic we talk about or anything that's random, they would come, they would make sure their friends have gone, or if they did it collectively, they will come and give you. So you don't know who gave you who or
Yeah.
who. So what we do is we read out the questions. And because there's no name, you don't know who the
Who
person
wrote
is.
what? Yeah.
Yeah. So that
Oh,
helps people to talk about their issue. So we started doing that, and more people started coming in. So girls would come almost 45 minutes by driving just to come to the project, the session, and they'll bring their friends. Their friend has been raped. They'll say, Auntie, please come and help. And this is what has happened. This is it. So you start hearing stories on stories. It's okay for sometimes we hear stories where the grandma is saying, it's okay for my daughter. I just left the house. Her boyfriend is in the house. She's sleeping with her boyfriend. And she gets pregnant, and life is going on. So we start. It's intense. Well,
Yeah.
that's exactly where I've gotten my experience, seeing a lot of and hearing a lot of
That's really
stories.
awful. But I mean, I've heard so many, but this I've never heard in terms of, like, it's okay for, I know I've heard about, parents or step parents, sleeping with their, raping their stepchildren or
Yeah,
stepchild, but I haven't heard of like how it's okay for them to actually do it. Like, it's accepted.
it
That's
is.
that's something new. I mean, like, you think you've seen it all, or you've heard it all. It's just like in every time we turn around, it's something different.
Yeah,
Yeah.
it is. To us, when we started, it felt like, what on earth? What is it? So every day we get to hear new things. Like
Yeah.
the children come, Auntie, we want to tell you something. Some of them tell you what the teachers are doing to them. Some
Oh,
of the girls, even in school, where the school is supposed to be a safe space, the
yeah.
women will bring the girls to the assembly and say, "Oh, she's been raped. She's a lousy girl." Yeah. The thing is,
So
there are lots of
they're shaming
community.
her in front of the whole school.
Yes, they shame them in front of the whole school. So most of the girls keep quiet. And also because we have cultism as well. So the boys, either in school or who have finished school, are interested in a girl. If the girl says no, they use the dogs. I was telling somebody recently, they use the dogs to chase the girls. If you don't agree, they use the dogs to chase you to a corner, then they rape you. So it's what I tell somebody. I says it's just pockets of the community. You hear things you don't. When you go down inside the community, you are like living there. It's like an ethnographic research that you cannot explain. That is it. So you hear this story. So I feel we can do it. Affects a whole lot. We had a
Yeah.
case. She became silent. If she's talking to you, she's the lowest of all the voices. So we had to push, went to her school, realized even cultists were at the time threatening her and her friends. One of them had developed confidence skills, so was able to address the boys. Herself, because of what has happened, her mother separated from her father. So these are things that can happen if you don't. That's the importance why you should talk about it. So she's left her father's house. Her brother also decided to try to do incest with her. So she moved with her mother. Her mother was diabetic and hypertensive. There was no money. They went to the general hospital. So we didn't see her for a while. So we contacted her. What's happening? What's wrong with you? She's like, oh, we couldn't pay the bills in the hospital. So we are being held here. So suddenly someone came to rescue them. She missed out in school. And then we finally got to where they were living. They were living in the poorest of all. You know the palm fruit, the banga.
Mhm.
So the mother was eating directly from the banga itself, from the way you harvest it. That was how she was eating it. That was the level of poverty.
Yeah.
So when you talk about girls' health, it's not, oh, what are you talking about? It's beyond just talking about safe sex.
Yeah.
It goes a whole lot from nutrition. What are you eating? Where are you going to? How are you coping in schools?
The
So
environment
it's
itself as
the
well.
environment itself. So it's a whole lot of things. So it's really important because it affects from head to toe, inside out. So it's something we should continue to talk about.
Yeah, I'm really glad that we are shedding light on this. Hopefully, more people will advocate for some of these girls, because these are horrible things that are happening, especially girls that don't have the voice, that they live in underserved communities,
Which is,
like where you work, And so now I'm going to go to the menstruation part, because I know we talked a little bit about it here and there,
yeah,
but like, um, now most girls are reaching that age stage, pretty quickly.
Yes.
I mean, like, we see young girls as early as 8, they are on their menstrual cycle. And, I mean, for me, this is very young age, right? Some of the girls,
Yeah.
they don't even know who they are. I mean, they're a child, children,
Yes.
you know what I mean? Like,
Yes.
the kind of pain, the menstrual cramps that comes, I always think like, I can't even imagine like, like them being able to handle that. So now you're thinking of the stress that comes with, menstruation itself. So do you feel like these girls, from your work in the community, like, do they have access to the basic need, like, pads and all that, to actually take care of their menstrual cycle when that time is here?
Oh my days. It's been a mixed experience. So we've had people we have girls who can afford, but recently in times they can no longer afford because of the prices. So when we first started the menstrual hygiene campaign, which I think was about 3 years ago, they cannot afford the sanitary pads. They cannot, it's expensive. So majority of them, so I think that day we had about 40 girls. So it's only about 20 of them that you could say they were managing, they were struggling to get, okay, my mommy, I take from my mom's um, pads and use because my flow is not heavy. So those who have heavy flows or those who flow more than 3 days, 4 days, they get to support with cloth, they get to support with towels or anything they feel like. I think there was somebody who said she uses paper.
Hmm.
Yes. So Monsieur Health. They don't have access. That is those who are talking. And in the last couple of like 2 years now, we've had people who are like, Auntie Wayimi, when are you going to do this reusable pad? Auntie Wayimi, I did a video on Facebook about I got my university was selling the menstrual cup. So
Yeah.
I made a video. The response I got, Auntie Wayimi, when you are coming, can you bring? Let
Oh,
me try it.
okay.
Because they are like, pad is expensive, pad is
Mhm.
expensive, we cannot afford
And
it.
the menstrual cup is reusable. So yeah.
Yeah, so when I explained about the menstrual cup, it was as if I'm advertising a miracle. So that's it. That's the extent of
Yeah.
they don't have access.
Desperation. Yeah.
Yes, some of them don't understand what tampons are.
Mm-hmm.
So, and then there's this myth that if you use a tampon as a virgin, you're going to
Yes.
disvirgin yourself.
Mhm.
So, basically, there are a lot of things we get to unpack in measurable access. It's not so much. Even women come most times, matured mothers come
Yes.
and say,
Yeah.
"Please,
They need
Alpha,
something.
help
Yeah.
me. We
Mhm.
need something." So, it's not so easy, really. So many of them are using cloths and towels.
Yeah. I mean, it's very heartbreaking, but and like we said earlier, that more needs to be done, in terms of reaching out to these communities and helping these young girls and women, in terms of their health. So, what do you think is the public health implication of all of this?
Public health. That's where we are bringing menstrual hygiene day. That's where I guess menstrual hygiene day is coming. Another interesting thing is, I think Nigeria needs to come together, like public people who are into public health, people who are advocates for these kind of things. They need to come out together. The way India, Bangladesh, Ethiopia, they are pressing so much for this. Let's see how this menstrual hygiene. Because I worked as a water sanitation and hygiene intern for a while. I could see the dear need of advocacy, wash in schools and all that. So we need to come together, see what works for us. Do we need more of the reusable pads? Do we need to now see how can we get the menstrual cups that are affordable, that are cheap? How do we now make this like a social enterprise so that women can also benefit from it and so give the girls and all that? Uganda is doing same, Kenya is doing same. So I think we need to, when we are advocating, it's not just a one-off. It should be something that we are seeing the
Yeah.
effect.
Mm-hmm.
We're measuring the impact. Okay, we delivered to 50 girls in this school. How did they feel about it? Did it work? It's worked in Bangladesh, it's worked in Ethiopia. What about Nigeria? If it's not working, how do we fight for tax so that the tax can come down, so that the price can be cheaper? What do we need to do? So all those health implications, because also the girls are using different kinds of things for their menstrual health. They
Yeah.
don't know the effect it's having on their health.
Health itself, yeah.
And also we're talking about just, if it's just health itself, we're talking about infections and all that. We're not also talking about their missing schools. I worked in a community where on the days where they are seeing their period, so they don't come to school for 1 week. So you miss classes for 1 week. So the question was, if you had exam, what will you do? Say, yes, we'll miss the classes because there's no toilet and there are no pads or any. So they rather stay at home. So that has an effect on education. Education is also under public health. It affects their mental health because some undeserved communities still have cultures.
Yes.
Like some cultures, growing up in our own community, my grand uncle used to put a leaf by the house. So when my cousin is on her period, she go and look for where to stay for the next 7 days.
Yeah, I've heard of some cultures around the country where they build like a small space for girls during their period. They are not allowed because they consider like dirty during that
Yes, they
period.
are. Yes.
Yeah,
They
yeah.
are. So my cousin also had that experience. So I asked, so the difference is we're in the same community,
Mhm.
but there's a primary school and then there's my house. So the primary school is the demarcation of the new culture or the new development, and then backward into the community, it's where all the traditions happen. So
Um,
if your house is on this side of
So you
the
have to abide by those.
you
Yeah.
have to abide. So luckily, when we moved her, when she came to stay with us, though she just moved houses, it felt like a relief. So even when we go and visit, her father would say, "Don't come into my house. Go to this small space." They won't share food together. They won't eat
Yeah.
together. So those kind of cultures still remains intact in many riverine areas, many
The
communities.
stigmatization. Yeah. Mm-hmm.
So we need to work, and it affects their mental health. They feel they are dirty. So they feel like, I'm dirty, there's something wrong with me. That's why most of the women try to be men. The only thing they can't remove is their wombs.
Yeah.
So, because they will tell you, you hear most of our mothers, from especially from the Niger Delta, they'll say, small thing, let me not be man. So they
Mm.
do everything to prove that they are what men, they are what they stand of men, they are the same like men. The only difference is that they bear children, they see their period.
Yeah.
So those kind of thing affects the girls mentally. You miss school educationally, you're not eating well, it goes on like that.
Yeah. Yes, I mean, you learn every time. I learned a lot, from our discussions, and I hope that people will learn from our discussion today as well. In terms like you opening our eyes to some things that we don't even know that is happening,
Yeah.
in different communities. I mean, you think you've heard it all, but talking to people like you that work in communities, so when you're there, I mean, I used to work in a community, but I mean, my experience is vastly different, from what I'm hearing, from you. And I guess it's safe to say then that, public health is still underrated, in that regards, because we have a lot to do in terms of reaching people in the underserved communities, So thank you so much, for coming on today and shedding light on and educating us. This is just I think we have to do something in terms of whether it's collaboration or making sure that some of these girls they get what they need, because these are basic stuff and they don't deserve some of the stuff that they're going through, so, and I commend you for the work that you do, and
Thank you,
I
God.
mean, I'll be more than happy to for any collaborations if you will, and just let me know, because this
Okay.
is something also that I just I'm passionate about, because I believe that I mean, girls, we shouldn't be subject to second classes, and I mean, we are human just like anybody else, and we should be treated equally. So thank you so much for all you do. We appreciate you, and like I said, I want to be like you when I grow up. I don't even know when you get to sleep, because you're always on the phone.
we have to because there are lots of things going on and you want to help. You try as much as possible just to like pull your resources
Yes.
together and all. So today's been an essay competition, so we've been online just to like share people up. So the joy of eh, people in the lockdown, young girls in the lockdown, not going to school, getting your family, you bringing 30,000 to your family. that, that is a joy. So I just try my best.
Yeah, thank you. And
Thank you.
you know, I want to thank you again for taking that time out of your busy schedule to chat with me, you know, today. Thank you so much, and you know, continue to do what you do because I know you love it, and it takes one person at a time to make that impact, right? So yeah, so I hope you continue to do what you do, and we appreciate everything that you do. Thank you so much, you know. So
Thank you, Doc.
yeah, so we'll talk to you later, and I hope you'll come back again and you know, share some of your other projects with us, because I mean, it's been amazing, you know, hearing some of your experiences in the community. So thank you so much.
Thank you, Doc. Thank you. I appreciate.
All right,
All
take
right.
care.
Take care. Yeah. Bye.
Bye. That's it for today's show, and I want to thank you, Dr. Weyoms, so much for coming on today's shows, for enlightening us on girls' health, educating and empowering young girls in the underserved communities. So, and if you have any public health topic that you would like me to share, shine a light on, or you want to appear on the show, please feel free to DM me. I'm more than happy to take a look into it. Until the next video, continue to practice the safe preventive measures in place, and stay safe and stay positive. Thank you so much, guys, for watching.